But let's say that your child is feeling sick and coughing and having a hard time, and it's the middle of the night. Our clinic isn't open. What kinds of things can you do? A few things that are easy to do. Cool mist humidifiers are very helpful, especially if the child is having a barking, croupy type of cough. If that doesn't help, then you can take your child out, wrap them in a warm blanket, take them outside, and let them breathe that cold night air. And a lot of times that'll be enough, 10-15 minutes, and you bring them back in and they can go back to sleep. However, if that isn't helpful, then that is something that you would want to bring the child in for. And if it is the middle of the night, consider taking them to the ER and getting them treated there. Another thing that you can do from home, if your child's having a lot of nasal secretions, having a hard time breathing, having a hard time eating because of the stuffy nose, using those blue suction bulbs with a little bit of saline, and you need to actually drop the saline in there and leave it in there for 20 to 30 seconds, which seems a lot longer than it really is when you've got a screaming kid at home. But it's very important to leave it in there. That softens things up, and then you can successfully take out some of that congestion that's causing them to have a hard time. However, there are times when a child is very, very stuffy, the virus is at its peak, and that's not enough. And when that happens, bring them into us and we can help. One other thing that's very important to look for at home is dehydration. A lot of times, especially little children, they don't have a lot of reserve, and so if they're not drinking well, then especially if it's because of a stuffy nose, they're not able to take in very much, or especially if they're having nausea and vomiting and just not keeping anything down, they need to be watched very closely, and look and see, when they're crying, are they making tears? Are they having enough wet diapers? If they're having two wet diapers or less in a 24-hour period, or if they're not making tears when they're crying, that's something we need to see them for as well, to ensure that they're going to be able to maintain their hydration and be able to improve from that standpoint.